So in this video we're going to go over a little bit of troubleshooting when you are doing the half kneeling sit back, when you are getting a little bit of pinch, or you actually have some kind of bony changes, scam or pincer lesion or both, and you are getting that pinching on the very top, like what to maybe try, or what to explore, what are the options. So I'll just go over the very basic setup, which is usually causing the trouble. So when you try to set up that half kneeling sit back, usually the common way to set it up is there is going to be a little bit of anterior pelvic tilt, and there is going to be that hip is going to be high over here. When you try to put it down just like this, you will start to feel like there is that little bit of pinch in the front. The easiest thing what to do about it is basically just tilt your pelvis. So instead of being in the anterior pelvic tilt, you're just going to tilt it a little bit backwards. So let's say tailbone down or like up over here, and getting that little bit of intra-abdominal pressure. It's going to stretch those hip rotators down over here and open up a little bit of that space. But just bone on bone, it's going to give you a little bit of extra space. If it still pinches, what you can do is just elevate basically the knee. So you're going to decrease that hip flexion just from here, let's say down over here. You're going to have another options. If it is pinching in the front leg, which is usually the case, you might want to use some kind of band which is attached to the wall. You can use a banister or something, and if you don't have a band, it's just old bicycle tube, cut in half, make a knot, and just you can use that like some kind of DIY option. What you want to do is get that band, so it's going to be pulling almost like to the side and a little bit back. So I'll just show you how to set up into that. Again, a little bit of tension, which is pulling me to the side and also a little bit back. So I'm going to set up my pelvis, I'm going to get my intra-abdominal pressure, and then I'm going to rotate towards that leg and then do that hip hinge. And before, if it was pinching, now you might find that like you are able to go a little bit further. And again, like just practice. The most important is you shouldn't go all the way to that pinch. You should feel nice stretch in the back of your glutes, or on the other side, you shouldn't feel pinching sensation over here. If you do, again, just recheck that you didn't tilt your pelvis backwards, and rather than basically going into the hip flexion, you are not kind of doing the anterior pelvic tilt. I will just show you from the side. So that you are doing hip flexion over here and you are just not tilting pelvis, because that's going to close that joint space on the very top pretty much the same way. The other alternative is basically to do that hinge with the little bit of extra tension on the back leg. I'll just switch the side for this one. So you're just going to step again into the band, try to get it as close to your private parts or the groin as possible. Then you are just going to step, let's say I'll show you on the other side. Again, just tilting that pelvis, a little bit of rotation, and then hinging back, going forward. It's going to give you a little bit of resistance, a little bit of cue what to feel. This way the band is going to be gently pulling the hip backwards, giving you the little bit of extra space, so you're able to go a little bit further down without feeling any kind of pinch, any kind of sensation over here. Again, like this exercise should be pain-free. You might feel like a lot of stretching in your glutes, a lot of burning around your VMO, maybe a little bit of stretch under your rotator quad or the TFL, so on your side of your hips. But you should feel absolutely no pinch in the very top. If you still have a pinch, I would possibly just consult with your therapist or with your health provider if there are some techniques like distraction or some kind of traction with the band, or similar techniques to give you the little bit of joint space, and then you can follow up with this exercise. But in no case it should be painful, because if it is, it usually gets quite irritated, inflamed, and then it's going to maybe take a few days to settle down. Guys, so hopefully this video was helpful. If you have any questions about this not so simple topic, just let me know.